Welcome to our Cardinal Care Virtual Education Provider session. We also want to take a moment to thank you for your time and for taking care of our Virginia Medicaid members. We appreciate you and the work you do. Cardinal Care is DMAS's program name that includes all Medicaid members served through managed care and our fee-for-service delivery systems. Our agenda for today. We are going to take a moment to go over some background and goals for Cardinal Care Managed Care. You also may hear the acronym CCMC. We're going to talk about what is staying the same and what is changing. We will provide an overview of the foster care specialty plan and of the model of care. Also some reminders and provider resources, and then our 5 health plans are going to provide presentations to you. A Virginia Medicaid overview. Most of the Commonwealth's Medicaid members who are eligible are enrolled in an MCO or managed care organization making this reprocurement. We offer coverage to nearly 2 million Virginians. Our Virginia Medicaid populations. Medicaid coverage is available to Virginians who meet specific income thresholds and other eligibility criteria. This slide is a breakdown of those populations that include children, adults, and older adults, as well as pregnant, postpartum women, and limited benefit individuals. DMAS's strategy to improve Virginia's managed Medicaid program started in 2021 with a legislative directive to consolidate the 2 managed care waivers and contracts, and also with an enhanced model of care that has already been implemented and with the reprocurement. This program adds value to the Cardinal Care Managed Care program, no changes or reductions to covered benefits, same populations and services that are included, and also the same populations that were also excluded. Leverages technology, innovation, new payment models, and community partnerships. CCMC puts the member at the center, making sure all of their care needs are met for our members and that care is being coordinated as needed. It includes responsive and holistic care management, will enhance availability and access to our members, improves linkages to resources to address health-related and social needs, includes increased opportunities for members to live in their setting of their choice, promotes quality of care and quality of life, adds a new foster care specialty plan that will focus on providing tailored and wraparound supports to address the unique physical and behavioral health needs of children and youth in foster care. The next couple of slides are our top 10 goals of Cardinal Care, and we're just going to highlight a few. To strengthen provider access, adequacy, and availability through streamlined administrative and payment processes, training, and monitoring. To support members with high-risk factors through case management and other resources to support health-related social needs in the community. Provide support to children and youth in foster care and a dedicated health plan and services to meet their behavioral and health needs. And also, lastly, to drive innovation and operational excellence with a focus on value-based payment arrangements and improved outcomes. So let's talk about what is staying the same. There are no reductions in services and benefits. Existing service authorizations issued by DMAS or the previous health plan will remain in place for at least 30 days or the length of the authorization, whichever is sooner. There is one managed care program, but providers may have to sign up to 5 contracts with the health plans. Providers will continue to be enrolled with DMAS and periodically revalidate directly through the Provider Services Solution Portal, also known as PRSS. And as it is today, newly enrolled Medicaid members will be in fee-for-service for a short time prior to enrollment into a health plan. Now let's take a look at what is changing. Humana Healthy Horizons of Virginia is CCMC's new health plan. Molina will no longer be available. Providers can start contracting with Humana now. We have a new model of care with a stronger focus on member-centered care with holistic and responsive care management. Anthem HealthKeepers will serve as a single statewide foster care specialty plan for children and youth in foster care. adoption assistance members, and individuals with former foster care eligibility. There is increased availability and accessibility of care across all settings, improved network adequacy and access for members, a reduction in provider administrative burden through standard credentialing processes, more specific MCO clean claim and prompt pay requirements, additional provider training and technical assistance. There is monitoring of provider network compliance with appointment availability standards and to promptly address issues at the individual and regional level. Transitions to Humana. Molina members will be enrolled in Humana Healthy Horizons of Virginia with an effective date of July 1st, 2025, and will have 90 days from that effective date to make any changes. After this period, members will have to wait until the next open enrollment period to change their health plan. Existing service authorizations will be honored for 30 days. There will be a special CCMC enrollment period. Members will be able to compare and select a new MCO during the enrollment period between June 19th and September 30th of 2025. New plans selected before the 18th of the month will be effective the first of the new month, and new plans selected after the 18th of the month will be effective the first of the following month. CCMC members do have a choice to stay with their current plan or change plans. With CCMC, there is a responsive model of care. This model of care fosters an interdisciplinary care team, also known as an ICT, to promote member health and well-being, and also supports the member's choice to reside in the least restrictive environment and facilitate successful transitions. There are 3 different levels of care management intensity: low, moderate, and high. There is enhanced Cardinal Care Managed Care, care coordination, which is now available to all Cardinal Care members. As you can see from this diagram, the level of care coordination will be based on a member's needs, not just the type of Medicaid that members have or their diagnosis. The model is designed to adjust as an individual's needs change. The Cardinal Care Managed Care Health Plan care managers partner with you as providers to support members. Care managers will provide supports for medical and also non-medical needs. This may include health risk assessments and development of comprehensive care plans. Wraparound services will be established and will address non-medical needs, such as, example, housing and food access. Should you want to learn more about the new model of care, you can refer to the Cardinal Care Managed Care 2025 contract on our DMAS website. The information regarding the model of care starts at section 8.0. We are now going to talk about the foster care specialty plan. For Virginia's purposes, this is how each of the eligibility categories are defined. Foster care. All children in foster care are categorically eligible for Medicaid unless they are not considered Virginia residents or have income or other financial resources that make them ineligible. Former foster care under the Affordable Care Act, young people in foster care who turn 18 and age out of the system are eligible for Medicaid up to age 26. Adoption assistance. Children with special needs can be eligible for Medicaid coverage to facilitate adoptive placements and ensure permanency for youth. All eligible members will be automatically enrolled into Anthem's foster care specialty program unless the members elect to opt out. The foster care specialty plan does have value-added benefits. This population can elect to opt out, but if they do, they will lose the value-added benefits that the foster care specialty plan will provide, and a few of those are highlighted here on this slide. On this slide, there are key reminders for you as providers. We want you to note the provider enrollment phone numbers, in-state, out-of-state. There's also an email for the Virginia Medicaid provider enrollment, which is Gainwell Technologies. And also MCOs will talk more about the PRSS process. This is a great visual slide of the front and back of all the MCO member ID cards so that you can be familiar when you're working with our members. And this is also another good slide for you as providers so that you have all the information you need to contact the MCOs and know how to contract with them as well. This concludes the DMAS portion of the presentation, and now we will hear from each of the health plans.
Aetna Better Health of Virginia has a long-standing commitment to serving Medicaid members in Virginia for nearly 3 decades. We have a deep presence in the community that allows us to authentically understand the unique needs of our members and build strong relationships with provider partners. Our focus is on enhancing the health and well-being of every individual served. As our programs evolve, our core mission of achieving a healthier world stays constant because healthier happens together. Aetna is easy to do business with. Our provider relations team is dedicated to enhancing the experience for healthcare providers by ensuring quality and efficiency. We offer an online self-service portal, Availity, for managing claims and authorizations, and that streamlines processes for providers. Our Quick Pay program is particularly beneficial for safety net providers, helping to improve cash flow. Additionally, we have customized provider manuals, like for our doula providers, so they can access all of the information they need in one place. Also, our web-based training modules promote health equity and compliance. Our flexible engagement model helps to make sure that providers can focus on patient care without administrative burdens. Here's what Aetna is doing to make it easier to be part of our network. We're committed to simplifying the process for providers to join and thrive within our network. Innovative contracting strategies and value-based payment arrangements are designed to enhance quality outcomes and retain providers. Also, our AVIP model incentivizes providers based on patient health outcomes, ensuring a focus on quality care. Efficient credentialing processes, supported by technology, allow for quick verification and compliance. The use of our customized CRM tool, PEERS, enhances visibility and analytics, enabling proactive support for providers and reducing administrative challenges. What can providers do to help Aetna make sure that the changing needs of our members are met? Providers can always connect with a member's care manager via member services to report changes. Just call 1-800-279-1878. Plus, we regularly provide educational materials and samples of our kits to your offices so you know what our members are getting. We also encourage you to share our value-added benefits member guide with your patients. It's a guide that covers everything our members need to know to use their enhanced benefits, like how to get free rides, free cell phone services, and more. We also communicate these benefits to our providers in our provider newsletter. Both the Value-Added Benefits Member Guide and our latest provider newsletter can be accessed on our website at aetnabetterhealth.com/Virginia. Plus, learn about different programs we offer to our members, like our Justice-Involved Care program for members who were recently incarcerated, or our Maternity Care program, where every pregnant member is assigned a care manager up to 12 months postpartum. For our MLTSS members, these members are supported by a care team. What is your role as a provider? Your role is to communicate with care teams, members, and caregivers, collaborate with us on the ICP, maintain ICP in the member's medical record, participate in the care team, remind the member of the importance of the HRA, encourage the member to work with their care team. We appreciate all that you do for our members. Our providers can access a wide range of resources and reference materials on our website. These include provider announcements, newsletters, notifications, our provider manual, and our quick reference guide, which is a valuable resource that contains useful phone numbers, websites, and more. And you can download and print it to display in your office. Additionally, We offer information on enhanced member and value-added benefits, as well as member rights and responsibilities. To join our network, providers must enroll in PRSS and sign an Aetna Better Health of Virginia contract. The provider enrollment process is initiated with DMAS through the PRSS Enrollment Wizard, which can be accessed at virginia.hppcloud.com. Once approved, providers can use their PRSS portal online account to revalidate enrollment, make changes to personal or business information, and check member eligibility. For any inquiries or assistance, providers can always contact us online or by calling 1-800-279-1878. Again, we appreciate all that you do for our members.
As we begin this new chapter of Cardinal Care, Anthem HealthKeepers Plus wants our valued providers to know that we want to be more than just a payer. We plan to be your partner in improving the overall health of the Medicaid patients that you serve. We've developed a comprehensive approach to supporting providers and members through a focused strategy that emphasizes streamlined processes, member well-being, and provider support. Anthem is creating a healthcare environment that is efficient, responsive, and centered on the needs of both the providers and members. Anthem streamlines the credentialing process with CAQH. This simplifies onboarding and recredentialing, allowing providers to focus more on patient care than administrative tasks. In addition, Anthem has embraced automation to apply provider demographic information from the state's PRSS Provider Enrollment Portal. This technology-driven solution minimizes the paperwork that providers must submit when they join the network or when they need to update demographic information. Anthem also invests in quality incentives and shared savings programs designed to maximize the provider's revenues while promoting better healthcare outcomes for members. These programs are structured around the principle that prioritizing members' health benefits everyone. Anthem's provider training programs, like the Pathways program, supplement these initiatives by supplying relevant, tailored content that supports providers in delivering high-quality care. Monitoring provider billing patterns and identifying claims system issues is another area where Anthem steps in to offer support. By analyzing claims data, we generate targeted messages to educate and inform our provider billers. This year, we are introducing new tools to communicate directly and more efficiently with your billers about issues that affect their work. The result is a more informed provider base that can focus on delivering outstanding care without being bogged down by operational challenges. Anthem's focus is our whole health strategy, which emphasizes a person-centered approach to care. Anthem's specialized clinical teams, alongside strong connections with community organizations, amplify this strategy, creating an ecosystem of care that supports the well-being of children and their families. By fostering robust community partnerships and focusing on targeted population health, Anthem ensures that high-quality providers are incentivized to deliver top-notch services, highlighting the organization's dedication to excellence in care provision. Anthem provides a wide array of benefits dedicated to enhancing member experiences across various facets of life. For youth, members may receive access to resources such as books, grocery gift cards, youth club memberships, and sports physicals. These benefits aim to support the physical and mental growth of children and adolescents, ensuring that they have the necessary resources to thrive in all aspects of their lives. For employment support, we offer vouchers that cover GED testing and application fees for post-secondary education. This underscores Anthem's commitment to supporting the professional development of our members, ensuring that they have the educational qualifications needed to pursue better career opportunities. Transportation is another vital component of Anthem's member benefits program. By providing access to transportation for medical appointments, pharmacy visits, and other essential services, Anthem facilitates seamless access to necessary healthcare services. This capability ensures that members can receive timely care without the barrier of transportation, which is a persistent issue many individuals face when accessing healthcare. In the realm of technology, Anthem offers members a free cell phone with a suite of digital health apps alongside enhanced benefits for hearing aids and 24/7 access to physicians for urgent care needs via computer, tablet, or smartphone. The integration of technology into healthcare services represents a forward-thinking approach to healthcare accessibility, ensuring that members can engage with their health providers in a manner that is convenient and accessible. We also provide a range of lifestyle benefits to support the everyday needs of our members. These benefits include personal and feminine hygiene products, home-delivered meals following hospitalization, home safety items, and assistance with obtaining identification. Such practical support services are designed to ensure that members can maintain a dignified standard of living while focusing on recovering or maintaining their health conditions.
Anthem proudly introduces our new foster care specialty plan as Virginia's trusted choice for children in foster care, adoptees, and young adults aged out of foster care. We are dedicated to partnering with you, our providers, to ensure that every child and family connected to foster care receives the highest standard of care. Anthem's foster care specialty plan significantly improves the lives of our youth by providing unique benefits tailored to the wellness needs of children and young adults in foster care. These benefits embody our commitment to nurturing a healthy environment for our members. As trusted partners, you deserve seamless and efficient support, allowing you to focus wholeheartedly on providing exceptional care. We offer dedicated support lines tailored to resolve your member-related concerns swiftly. Our specialized support team is here to assist you every step of the way, offering a seamless experience designed to meet your unique needs. Anthem Foster Care Specialty Plan is your trusted ally in fostering health. At the heart of our plan is a dedicated care management team, ensuring personalized guidance and support. They work diligently to eliminate barriers to care by helping locate in-network providers, coordinating vital medical and behavioral health visits, transportation, pharmacy needs, and much more. You're not alone in your mission to provide focused, comprehensive care to this unique group of members. Anthem is committed to enhancing your capacity to care for youth in foster care by offering specialized training on critical topics, including the effects of trauma. We are proud to support clinicians' training in evidence-based practices. Our goal is to empower you with the skills and knowledge needed to deliver care that meets the unique needs of these individuals, fortifying our partnership with shared excellence in care. We're not just a payer, we are committed to partnering with you, providing the best possible care for youth experiencing foster care. Join us in our mission to ensure that every child and family connected to foster care and adoption thrives. Visit our provider website for more information and to discover how, together, we can make a profound impact in the lives of these children and their families to create a brighter, healthier future.
Thank you for entrusting us as your healthcare partner. We remain dedicated to providing personalized, proactive care to promote the health and well-being of our members. Please get in touch with us for assistance or inquiries. Anthem is committed to member rights, ensuring fair treatment, privacy, and the ability of members to participate in decisions about their health care. Member rights are protected by laws, including the Americans with Disabilities Act, protecting access to safe, timely care, and the ability to update medical records or report any issues. If you experience dissatisfaction, you can file a grievance at any time with a decision communicated back to you within 90 days. Appeals against any services denials can be requested within 60 days, with expedited options available for urgent needs. You can file grievances via phone, the secure member portal, or by sending a written request. A representative can act on your behalf to ensure all concerns are handled effectively.
Humana Healthy Horizons in Virginia is the newest health plan to join the Cardinal Care program. Humana is creating a fresh brand in Medicaid by using our differentiating capabilities to enhance the provider experience. Humana has 30 years of Medicaid experience managing a variety of populations from TANF and CHIP to specialized programs such as LTSS, ABD, IDD, and duals. Humana employs over 950 Virginia-based associates, so we can be part of the community we serve and offer the benefit of dedicated local support to both our members and providers. We deploy 3 complementary provider support teams: provider relations staff, claims educators, and provider performance improvement specialists, who work with our provider community to make it as easy as possible to do business with us. Humana offers accessible tools and resources such as focused provider guides, Availity, and a population health insight tool that presents multiple levels of analytics and reporting. Additionally, we take a person-centered approach to caring for our members as we partner with our providers to integrate physical and behavioral health while also addressing members' health-related social needs. Let's dive a little deeper into how we make it easier to do business with Humana. We reduce provider burden by leveraging the MES portal to retrieve credentialing forms, eliminating any repetitive paperwork for your organization. We utilize CAQH to accelerate credentialing by digitizing the process using a single database to save time and reduce errors, and we align recredentialing dates across Medicaid and Medicare lines of business to make the process simpler. We partner with you to provide transparency and faster claims payment by publishing the first Friday of each month any new code editing rules and rationales. We offer a prior authorization search tool to assist in the discovery of verifying if one is required. Your provider relations reps will work with you to set up electronic remittance advice and electronic fund transfers so you can receive the most expedited payment option. Humana's provider services staff partners with you to provide tools and resources through our easy-to-navigate web portal, conducting provider trainings in open office hours, and meeting with you in one-on-one and group settings. Our staff is dedicated to supporting our providers and are available to help you navigate our processes and workflows. We also have staff available to collaborate in translating available data and reporting, and can assist in identifying tangible and impactful interventions that could support improved quality performance and value-based program outcomes. Humana Healthy Horizons care management model delivers a team-based, person-centered approach to managing our members, your patients, medical, social, and behavioral health needs. Our guiding principles include having a locally integrated team that supports trauma-informed and strength-based care interventions. We use a multidisciplinary care team to ensure comprehensive care for our members. Our dedicated CM teams partner with our providers to support members in their transitions by reducing admission and readmission risk, managing anticipatory transitions, reducing ED visits for non-urgent needs, reinforcing medical instructions and educating on disease processes, assessing and closing care gaps associated with health-related social needs, and discharge planning and support. In addition, our community health workers can conduct site visits to members who may be hard to reach. We have many care and disease management programs, including, but not limited to, neonatal intensive care unit case management, Humana Beginnings maternity program, behavioral health and arts care management, and chronic condition management. As a way of providing person-centered solutions, Humana offers a variety of dynamic enhanced benefits. Let's review a few of them. To support family well-being, Humana provides fresh and nutritious produce boxes to pregnant and postpartum members to promote a healthy pregnancy. Humana enhances the quality of life for members in restrictive settings through offering accessible and personalized support. Humana's enhanced services include a fall prevention kit that can reduce the risk of fall by addressing environmental hazards, and non-medical transportation that promotes well-being, maintains quality of life, and increases access. Humana offers a $65 quarterly OTC allowance, which is crafted to support members by providing access to essential care items, helping them both save money and maintain their overall well-being. Humana's preventive benefits, such as tobacco and vaping cessation and weight management coaching, are designed to enable members to take control of their health and well-being, ensuring they can lead healthier, happier lives. By working with a member's care manager, providers can help connect members to these and other enhanced benefits. Our enhanced benefits are included in the provider manual, provider orientation training, and are accessible on our website. Care managers, in collaboration with provider relations representatives, will educate providers on enhanced benefits when it is identified they are not being utilized. Providers are not required to submit an order, prescription, or request an authorization for enhanced benefits. However, providers are encouraged to educate members to contact their care manager. Humana realizes that early notification of pregnancy can reduce complications and improve birth outcomes. We offer providers the opportunity to earn a reward payment for timely notice of pregnancy submissions. Participating providers who submit 5 or more unique completed notice of pregnancy forms for members in first and second trimester will be eligible to earn a reward payment. Humana will offer a variety of additional provider incentives and value-based payment programs starting January 1st, 2026. Humana has established community partnerships and has provided funding to multiple Virginia-based organizations to support increased access, address care gaps, improve in-person support, and focus on meeting beneficiaries where they are in their healthcare journey. There are a variety of ways to contact Humana staff and to submit correspondences. Our online provider manual contains a full list of email addresses, mailing addresses, and phone and fax numbers. We've listed out some key contact information for you on the slide. In addition, our Humana Healthy Horizons member ID card contains key phone numbers such as member and provider services, pharmacy inquiries, transportation services, and clinical triage, so it is readily available to you whenever you see one of our members. Your assigned provider relations rep will be available to take calls, respond to emails, have virtual or in-person meetings, and it can assist you in obtaining Humana contact information. Our provider relations team has an email box, VA Medicaid Provider Relations at humana.com, that can always be leveraged to assist with any inquiries or concerns. Availability can be leveraged as well for many online transactions, such as submitting claims, pre-authorization requests, and reconsiderations, as well as to check eligibility or receive an electronic remittance advice. Humana offers access to documents and electronic remittance advice. Humana offers access to documents, forms, communications, programs, and contact info on our health plan website. Easy accessibility to prior authorization list, preferred drug list, and behavioral health resources are available. Plus, a variety of compliance training materials and resources are posted on the website. You can find a full list of services requiring prior authorization at humana.com/PAL. You have a choice of options for requesting an authorization. You can access it online by visiting the provider portal at Availability Essentials. You can call and follow the menu prompts for authorization request on the phone, or you can fax a request. Providers who care for Humana members can submit paper claims through the mail or electronically through Availability Essentials. Initial claims must be submitted within 365 days from the date of service. Corrected claims must be submitted with 180 calendar days from the date of the explanation of payment. When filing an electronic claim, providers should use payer ID 61101. To get paid faster and reduce administrative paperwork, we encourage you to sign up for electronic fund transfer and electronic remittance advice. Humana Healthy Horizons looks forward to partnering with our provider community as we serve the Medicaid beneficiaries throughout Virginia.
Since the inception of the Medicaid Managed Care program, Sentara Health Plans has served Virginians for 28 years and is the only Virginia-based managed care organization trusted by nearly 600,000 Virginians. A division of an integrated delivery network, Sentara Health Plans gathers insights from our family of physicians and facility providers. We use these insights to provide better support to our entire provider network. With a network of over 53,000 providers across Virginia, members have access to Sentara's system of hospitals, primary and specialty care clinics, and urgent care centers. Since 2022, Sentara has invested more than $770 million into communities across Virginia and continues to offer care through our Sentara Community Care Centers and mobile clinics. Sentara Health Plans offers a wide variety of supports for our provider network. Your most common interactions will likely be with our provider services team for inquiries related to member eligibility and benefits, as well as help for up to 5 claims. Beginning July 1st, our provider services line will be open extended hours from 7 a.m. to 7 p.m. We've added an extra hour on each end of the day to better serve you. Your assigned network educator is available for other needs, such as health plan updates, escalations for 10 or more claims, complex issue resolution, or contract concerns. Sentara Health Plans' partnership with Availity Essentials improves our payer-provider collaboration through reduction of administrative burdens, elimination of manual processes, and by providing access to self-service features. Our engagement opportunities include provider support visits, which are an extension of our monthly care gap closure series titled Provider Quality Care Learning Collaborative. We offer routine webinars on a variety of topics. These include new provider orientations, which are recommended for both newly contracted providers and new staff, claims clinics, and behavioral health sessions. We also offer pop-up sessions to address unique needs as they are identified. The Sentara Health Plans provider website, sentarahealthplans.com/providers, is a robust operational and educational platform that houses manuals, a variety of forms, printable self-help resources, a growing library of on-demand videos, and many important communication updates. The Sentara Health Plans model of care is extensive, so in the interest of time, we have highlighted only a few programs. The Welcoming Baby program provides outreach, education, case management, and follow-up by maternal health professionals. And the Substance Use Disorder Pregnancy and Parenting pilot provides education to community-based organizations on substance use disorder screenings for pregnant and parenting members. In the chronic care category, we offer the Diabetes Transition Program, which is staffed by a trained diabetes management team that works one-on-one with our members. Our Diabetes and Asthma program provides support to families managing a child living with diabetes and asthma. And Sentara Health Plans' Ponos Care program provides concierge-style care for members to address the physical and psychosocial aspects of chronic disease. Lastly, I'll mention 3 of our many behavioral health initiatives. Our behavioral health coaches collaborate with care managers to ensure members complete screenings and connect to prevention resources and services. Peer support specialists with lived experience support members in foster care, out-of-home child placements, the carceral system, and other traumas. And school liaisons promote health, well-being, and education within our school systems. We plan to add 16 new liaisons as the program continues. As you can see, Sentara Health Plans offers a host of enhanced benefits for our members. As this is only a partial list, we encourage you to review our Medicaid Provider Desk reference to learn more about Sentara Health Plans. It is important to ensure our members are using their benefits. Therefore, Sentara Health Plans will partner with you as a provider to ensure that you have up-to-date information on the many benefits we offer. Providers can remain abreast of our Medicaid enhanced benefits by reviewing the member's care plan as outlined in the provider portal, as well as participating in interdisciplinary care team meetings. Our care managers will contact members and providers when we note that enhanced benefits are not being used. We find that collaboration between Sentara Health Plans and providers reinforces awareness and promotes utilization. In addition, we routinely remind providers about the enhanced benefits throughout the year via website banners, email webinars, and other modes of communication. When a concern arises, you are encouraged to contact Sentara Health Plans to report a member's changing needs by calling member services and request to speak with the member's care manager or by calling the care coordination line. We have included a list of common health plan contacts. Most notably, the provider services team will be your first point of contact to verify eligibility, benefits information, and make inquiries for up to 5 claims. You should contact your assigned network educator to address special needs such as health plan updates, escalations for 10 or more claims, complex issues resolution, and contract concerns.
Welcome to the United Healthcare Community Plan Provider Education. Who we are, what is our mission and our values? Our mission is to help people live healthier lives and to make healthcare work better for everyone. Our values, integrity, compassion, inclusion, relationships, innovation, and performance are strived through our interactions every day. Our consumers, we strive to deliver simplicity to and earn their trust. Community care systems, we want to be a catalyst for a person-centered community-based health transformation. Our state partners, we want to be recognized leaders in delivering person-centered community-based health transformation. Enhanced benefits. Eligible members have access to a variety of enhanced benefits. One Pass Fitness. For members ages 18 plus, unlimited access to 300 plus gyms, premium YMCAs, and over 14,000 digital fitness options. Diaper rewards. Up to 500 diapers at no cost for attending prenatal and postpartum appointments, beginning July 1st, 2025. 6 for Kicks Plus. Up to $100 in vaccine incentives at Foot Locker and Walmart for members up to age 18. GED support for members ages 18 plus. Unlimited materials and support to complete the GED test at no cost. Menstrual supplies. Eligible members can receive menstrual underwear for free. Housing application reimbursement. Up to $80 in gift cards to reimburse housing application fees. Self-care. Mobile app for emotional health support at no cost. Doctor Chat by UHC. Live telehealth doctor visits 24/7. Weight Watchers. For members ages 18 plus, receive free vouchers. Social trip transportation. Up to 12 free round-trip rides to places of worship, grocery, DMV, DSS, gym, and more. Provider Portal, uhcprovider.com. Save time, get better documentation, and reduce paper by using our online tools, which include resources such as self-service provider training, check eligibility and benefit information, access claims information like status updates, reconsiderations, and appeals, submit prior authorization requests, access items in document library, UHC provider chat for live support, and more. Most questions can be answered using one of our online solutions at uhcprovider.com/digital solutions. Credentialing ease with Onboard Pro. Providers can save time with Onboard Pro as it integrates with CAQH ProView, so you don't need to re-enter the same information for the United Healthcare. Requires less back and forth. The tool will let you know immediately if additional information is required. Sends immediate confirmation. Will email you a reference number shortly after your application is received. Allows you to check status 24/7. Your personal dashboard will show the real-time status of every enrollment request you've submitted. Model of care, care coordination, MLTSS. Members have a variety of ways to receive care management support, by making outreach to United Healthcare Community Plan member services at 1-844-752-9434 or via our nurse line at 1-800-842-3014, or they may use the TTY line at 711, 24 hours a day, 7 days a week, to talk to an on-call nurse. Here's where they can receive assistance with health-related social needs, such as housing support, food insecurity, transportation, social isolation, and caregiver support. Network care coordination, facilitating care or DME for in-network providers. Authorization support, supporting authorization for environmental modifications needed in the home or personalized emergency response system. Provider communication. After assessment, care managers share the personalized care plan with the providers and invite to provide feedback and attend interdisciplinary care meetings. Model of care, care coordination, MLTSS. Within 3 months of becoming a UHC member, a representative will perform a screening for care management services and needs to support members in the community. Ongoing high-risk case management with monthly touch points for populations such as high-risk maternity, complex care, such as end-stage renal disease, behavioral health, and NICU. Supporting closure of gaps in care, including follow-ups with the provider or specialist. Before receiving LTSS, supports and resources, a community-based or hospital team will assess members to determine if they meet the level of care criteria and need for LTSS. How we communicate with you. There are various ways to connect with us through our online resource tools at uhcprovider.com, where you can find most of your information, our annual updated administrative guide, uhcprovider.com/VA community plan. You can also enroll in our network news at uhcprovider.com/news. This is a monthly publication that alerts to changes in policies or procedures and provides updates to the administrative guide. You may also reference our reimbursement policy updates, which alerts to changes in reimbursement policies and/or procedures. Provider key contacts. Our provider key contacts. Here you will find various ways to connect with us, such as our links to our provider service teams via a live chat, provider education and training, our resource library, and provider and community portals. We have reached the end of our presentation. We want to thank you for your time and your participation.